worked out for everybody then. But no, I appreciate everybody being here. And for those that might be joining here for the first time, my name is Ray Walters. I'm with EPICompliance. I'm joined here by my co-host, Jose Delgado Jr. He has been a part of these webinars since October of last year. Owns a
22,
mental.
not, or no,
All
23,
right. Oh my
23.
gosh. Yeah, now I can finally say that. Holy cow. Since October of 2023. Um, Jose's 20 plus years healthcare expertise and healthcare consulting, currently owns a mental telehealth clinic. And today we're going to be talking about vendor risk management in healthcare, and sort of going over that process of, obviously when you're dealing with a vendor, how to vet them and, make sure that they're doing everything that they need to do to stay compliant and ultimately protect your business. So, um, I guess, Jose, to set the stage, can you explain why you think
So,
vendor risk management is such a critical issue in healthcare today?
so let's set this up easily, right?
Sure,
I
sure.
want to make this as simple as possible. So I like to split my vendors or my business associates, or let's split it this way: vendors versus business associates, because a business associate can be a vendor, but a
Of
vendor
course.
doesn't necessarily have to be a business associate, right? So
True.
first let's split them in between the business associates and the vendors, and then the business associates, let's split those between providers and non-providers. All right. So we're
Fair.
going to knock out the easy one, the easiest one first, the one that's going to be your biggest compliance headache and the one that's used most frequently is the
Yamar.
provider that is a business associate.
Okay. I was gonna
And
say
the
Eve.
reason why is this: because they'll sign whatever, because most of them don't care. They just want to work and they want to be able to work at their leisure,
And you're
or they
talking
want
about
to
the
control their
1099s,
schedule.
right? The independent
Yep,
contract. Yeah.
1099 contractors.
Yep.
So you're contracted mid-levels, you're contracted radiologists, you're contracted providers, your locum tenens, if they're, whatever the case may be, right? Whatever permutation or combination therein of that contracted provider, or that subcontracted provider. You want to make sure that they sign a business associate agreement.
Absolutely.
Most of these guys are one-man bands. They just want to see patients. They just want to see, MRIs or CTs or whatever. So they're normally not going to be very picky. So just put the BAA right behind the contract. And as they sign the contract, they sign the business associate agreement, you file it away. If there's any issues on their end, you skewer them to that cross.
And when you
That's
say
simple.
skewer to the cross is, hey, if you don't sign
If
this,
the
I'm not
breach
doing
is on
business with
their
you.
end, if the
Yeah.
breach is on their end, if
Yep.
a breach ever occurs or if an investigation ever occurs or something like that, the BAA is there to design is designed to protect both parties,
Right.
both the vendor and the practice. However, just like every contract, whoever writes the contract usually puts in a few extra things in their favor, right? So if you're an EPICompliance customer, I know EPICompliance is a business associate agreement that is updated every year. It's
Every year,
updated,
baby.
and usually throughout the year, when Dr. Delgado and Dr. Headley come across some verbiage that they do like, or there's a court case or new legislation that comes through, or new regulations come through, the BAs get adjusted.
Yep.
So that one's quick. That one's easy. Let's move on. The vendors that you don't need a business associate agreement. This is very simple. Anybody who's not touching PHI.
Yep.
Anybody that is not having anything to do with payment, treatment, payment, or logistics.
I will say there's a common misconception as well. Sometimes providers will will reach out and ask, well, hey, does my employees need to sign a business associate agreement?
All right. So this is where that distinguishment between an employee and a contractor comes in
Exactly.
play.
Exactly.
If they are an employee, they're part of treatment, payment, or operations. Sorry, not
W-2.
logistics.
W-2.
Yeah, yeah. If they are a W-2, they are an employee of your organization. They are covered under your umbrella of whether you are a why am I blanking on this? whether you are a covered entity or you're a business associate, right? So if I'm a billing company, I may not necessarily be the covered entity, but I am a business associate of covered entities.
Yes.
Does that make sense? So if I'm a hospital or if I'm an ASC, all of my staff, my RNs, my MAs, my front desk people, my billing people, those are all employees of mine. But if I'm an ASC or I'm a hospital and I subcontract providers in to do services, then that's where that distinguishment comes into play. The business associate versus the employee that is the covered entity. If you're trying to figure out if you are the covered entity or not, are you the one billing for services? It's very,
Simple
very,
enough.
very simple. Yep, it's very, very simple. However, this is pretty interesting though, right? Like I can be a covered entity as a practice, and then I can refer to a DME. They're a covered entity because they're a DME, but they're a business associate of mine because of the
It's
relationship,
the
right?
relationship that
Or
you.
they're just a referral partner, and I don't have to worry about anything, right?
Mhm.
So it all depends on how that organization is structured. Let's try to keep this as simple as possible. The ones that are non-PHI, this is your cleaning staff. This is your
Maintenance.
maintenance. And this is your if you have a contract with certain vendors that are just bringing in inventory, so for example, if I'm dispensing any medication, for example, we do Spravato in our office. If we're on a buy and bill, I buy the Spravato from Janssen,
Mhm.
but Janssen is not a business associate of mine. They're a vendor
Right. Because
because they
you're
don't need any
purchasing
patient
and
information because
exactly.
I'm buying it and I'm billing for it.
Exactly.
Now, here's where they would become a business associate is if I am paying them for a service, right? So if I paid somebody to run my Spravato department, then that person that is part of a separate organization would be a business associate. That billing company is a business associate. Your IT is a business associate. Your printer leasing company is a business associate. Legal, absolutely is a business associate. So if you have general counsel or specialized healthcare counsel, they will usually send you a business associate agreement along with their contract. But if they don't, send them yours. Your EHR. Good luck getting an EHR to sign yours. They will always have one in there and it's always embedded in their contract. It's an addendum in their contract. I
I,
just did one for the new EHR we're moving to.
I'm just going to
Huh?
add, there's a lot of providers that don't know that they sign a BAA with their EMR companies. It's embedded in that
Absolutely.
agreement.
It's
It's
a, well,
just something I see happen a lot.
the way that it's set up because of how frequently the BAAs are not updated, especially with larger EHR companies. What they'll do is they'll have the contract and it'll be relatively short, 12
Mhm.
pages,
Mhm.
right? But then on that back 3 or 4 pages, there'll be another spot for you to sign, and it's always DocuSign. So you just click, 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 and we're done here, right? But those back 4 pages are always the BAA.
Yeah.
Always. I just signed mine with a pen. It,
That's
I just That's the way it was a 17-page document, 12 of which was a contract, 5 of which was a BAA. They
obviously
will not sign your BAA.
on the EPI compliance side of things, whenever we have a client that wants to send their EMR or EHR a BA, I'm like, you got to go back and look at the contract and look towards the end because you more than likely
Well, I
already
mean,
signed one. And
you
then,
always can, and you're honestly supposed to, if there are
yeah,
any major changes, make them re-sign.
yeah,
But the likelihood of an EHR company telling you that and finding out who to send it to
yeah,
is
right.
a giant mess.
Well, another thing
Giant
as well
mess.
is good luck trying to get them to sign your version as well.
Yeah,
That's
they
just not
won't
going
do
to
it.
happen. It's
They
not going to
won't do it,
happen.
especially since most of the EHR companies that are still in existence are following some kind of government mandate. They used
Yep.
to be government certified because the PPACA meaningful use that went away, but they're still trying to play games with macro and MIPS and all that stuff. And in order to do macro and MIPS, you got to be with a certified EHR, which is most of the boys now in the market. So. especially the bigger guys.
Yeah.
So there's that piece. Who else would be a vendor that you would not need not need a BAA with? Security.
UPS. Okay, security too.
Security. So both physical or, alarm security. So if I'm in a facility or I'm in a building, I'm not going to need a BAA with my landlord
Hmm.
or with my security company there. Because
Yep.
any information that is given to them, it's incidental. It's not because they need access to patient information. Let's see here. Who else? Who else? Who else?
UPS,
Um,
mail, postal
mail will never sign
employees.
anything because they're not supposed to open the packages, so they don't even know what they're sending. They're transporters,
You'd be
right?
surprised though. I've
So,
had providers ask me that.
yep, 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 yep. So, ones that would and normally are not brought up are transcription services, need them, translation services.
What about
So, if
meta?
you're using, huh?
Go ahead, go ahead, go ahead. I'll bring this up. I'll
So
bring this up
if
after.
you're one of the practices that is actually following ADA and you have translators for the five major languages in your geographical area, then you would need a BAA with those translators, unless you have somebody on your team that already speaks those languages. Um, so that's a whole nother bag of tricks. If you don't know, ADA is a pain in the butt. ADA has gone through so many changes. It changes the way that your website needs to be run properly and set up properly to the way that you interact with patients that speak other languages primarily. It's a whole thing. We could do a topic on just that ADA piece. Then you have billing companies, of course. You need that for billing companies. You need it for your 1099 contractors. You need it for your printer leasing companies. I know I say that one a lot because, you'd be shocked by how many people don't get those done there. You
Yeah,
also need, huh?
I said yeah.
And then you also need it, believe it or not, if you are part of an organization, but the person you're speaking to technically works for another company, you need a business associate agreement. Let me explain. Let's say that I'm an organization that has been bought out by a private equity group. So I'm part of an umbrella corp, right? Okay. If they are the owner of if they are part of the ownership of the company, then it's fine. But if they're in another subsidiary, you're still going to want that BAA. And depending on how that structure is set up, whether you're part of that parent company or you're a subsidiary, you're going to want a BAA no matter what, just to protect both parties. Because I guarantee you, there is a reason why you are part of a larger company and not folded into the main company. There could be a myriad of
Right.
reasons between logistics, between billing, between legal. There's a whole bunch of different things, especially because it's healthcare and Stark and all that shit.
Mm.
So, go ahead. I feel like you've
So,
been wanting to say something for a minute.
well, I was gonna say medical couriers.
Yes.
Yes and
Well,
no.
only if they're opening and knowing what they're transporting.
Exactly. Exactly. That's a
So
common one that's asked too, you know.
another one that I've seen recently that Ray and I were actually working with a client with was if you work closely with an ACO, a hospital, an MSO, where there is a high frequency with which you're sharing patient information, a lot of times you'll see that they're like, "Hey, I just give me access to the EHR and I'll just grab what I need instead of bothering you about it." It's a giant no-no. It's a giant no-no.
Yeah.
I don't care, and nor does the federal government care if ABC Acme Hospital sends me a ton of patients. They don't get to have their patient care coordinators have access to my EHR because then they have access to patient information, not just for all of the patients that they've been sending me, but also all of my patients throughout. It is a big Big no. Don't bloody do it.
Absolutely not.
Don't bloody do it. Now, if you're working with a patient care coordinator, which is completely common, especially for certain specialties where you're pretty much that's your lifeblood, that's your lifeline is keeping the patient care coordinators happy. That's fine. You can set up an expedited manner for which they can get the information that they need. However, out of convenience, do not just give them access because I promise you, if you were to go backwards on this relationship and say, I want access to your EHR, they will tell you to play in traffic. Not even pound sand. They will tell you play in traffic. So then, if it's not okay for them, why would it be okay for you? So we keep it simple here. We keep it real simple. Like turnabout is fair play.
Yeah.
So business associates, anybody that is not willing to sign a business associate agreement, you can end that contract right now.
Red flag.
It's a giant red flag. Well, it's a giant red flag and it's not. Let me explain. Maybe I don't want to sign a business associate agreement, or maybe I don't want to sign your business associate agreement. That doesn't mean necessarily I don't want to do the job, but it just means that just like every other contract, there needs to be some negotiations. If it's a flat
Sure.
out no, I'm not signing one, then you need to walk away.
Yeah.
But if it's a factor of, hey, I don't want to sign yours, you sign mine, and then you're going back and forth, you need to sit down and discuss whether how important that vendor is for you to go through the trouble of negotiating, and then ask yourself, what are they asking to change and modify? I
It's
personally
something
am
that'll
not
put more
opposed.
liability on you, versus
Well,
them.
or just maybe less liability on them, which
Ex-
inherently means more liability
Liability
on
on
us.
you.
It doesn't
Yeah.
extrinsically mean it, but it
Yeah.
doesn't infer it, right?
Yeah.
So
Yeah.
we want to go and make sure that when we set up these arrangements, that they're beneficial arrangements for all parties, but everyone understands that, hey, every alphabet agency, federally and statewide, is looking at us for any number of things. That does not include all the bad actors that are non government oriented that are also looking to make me go bankrupt. And then I have all of my patients that want to sue me for whatever bloody reason under the sun. There's so many guns pointed at our heads, literally or figuratively, in healthcare nowadays, that we need to be aware of who we're getting into bed with business wise because it can affect us economically. It can affect us legally. We can have what is called exposure for those that
Mhm.
are more legally minded, right? So we want to go and make sure that these vendors have the same kind of understanding that we do. Or if they don't have the same understanding, at least that they're doing their level best. So that way when things hit the fan, not if they hit the fan, but when they hit the fan, we can go and say, hey, we've been trying to hold our vendors accountable. This is the business associate agreement that starts that relationship and puts that onus on them to do the things they need to do.
Right.
You're never going to be perfect, and neither will they. So don't expect them to be perfect. The only thing you really want as a practice is to be able to push that liability onto them.
Is that all the practice needs to do, though, at the end of the day, is once the business associate agreement is signed, is there any due diligence
So
involved or vetting?
So the problem is that now with as many
Because
people that
you're,
are getting onto the no-no list through their vendors,
yeah,
right? Um, there is some guidance in regards from OCR and the federal government regarding the level of supervision one should take on vendors. But I'm going to be perfectly honest with you. No one has this mapped out well. If you're a small practice, less than 50 employees, 1 to 4 providers, I'm an office manager. I ain't got time for that shit.
yeah,
I'm dealing, I'm spending 40 hours a week on just human resources. Then I got to deal with patient crap. Then I got to deal with insurance crap. Then I got to deal with providers being upset about sky being blue. And then I got to babysit my vendors too. play in traffic. I don't have time for that, right? So, I mean, no.
I'm hoping the
Once
federal
they have
government
that BAA, yeah,
doesn't
once they have that BAA is
is the
enough to say that you, as the vendor, are going to take the responsibility to do what needs to be done under HIPAA.
right.
Now, some of the new guidance coming out, especially with some of the legislation regarding breaches and how hospitals are looking to get money from the federal government to help cover breaches because smaller practices, whatever. Hospitals just need more money because I'm a hospital. Not that they don't make plenty of money or waste it in other ways, but I'm going to leave that one alone for now. It's a new year. Let's be positive. So basically, what we would be looking at is on that new legislation, they're talking about we need to, as practices, ask the question of our vendors. Hey, have you done your SRA for this year? Hey, do you have policy and procedures up to date? Hey, what happens if there's insert catastrophic event? Hey, what about this? Hey, what about that? Hey, do you have an inventory for all devices that have PHI? Hey, you know what I mean? Like you can just keep going down that list. Now, I've done this just to kind of test this out since that guidance came out. My smaller vendors, one, got nervous, and two, some of them knew the information that I was asking about, but they didn't quite understand why I was asking for it. IT was the big one. They were very
IT. It's
skeptical.
always the
They were
IT.
very skeptical. They were very emotional. Even when I'm conducting SRAs, they get very in their fifis when I'm asking them questions of, hey, I need verification that you're doing the stuff you say you're going to do, or to say the stuff that you're supposed to be doing. So it gets very interesting in that respect. Um, my larger vendors, all they would say is you need to, if they were smart, they would say you need to talk to our legal department, but we are doing everything according to all federal regulations, is what most people would say. Which,
Fair.
if I was recording those conversations, would completely hose their frigging company because there's no way you can do all of it. None at all. So
Right.
never say that. If you're a vendor and someone asks you, you never, ever, ever say, we are covering everything. We are perfect. And anything that can be even misconstrued as perfect is a problem. So make sure you're aware of that. Um, Let me see, what else are we looking at? We've got IT, we've got escort services. So like if we're being driven around someplace, if I'm a driver, for example, then yeah, your driver is probably going to overhear some shit. You probably need to make sure you have a BAA with them,
That
or
makes
pay them
sense.
well enough to where they won't talk. Um, but it all depends, right? Like if there's a divider there, can they really hear anything, so on and so forth. If I have an assistant that works remotely, you need a business associated with them, unless they're an employee. So, I mean, again, this is another situation where is it worth having some parts of my business as 1099ers to reduce liability? And the answer would be yes, but then you have to follow all of the other things that come with being 1099, right? So it gets complex. So let's try to keep it simple. Providers, I don't mind giving them 1099s. Actually, I prefer it. One, I don't pay their malpractice. Yay! Malpractice is expensive as hell, especially depending on the specialty. In some cases, it can cost as much as, an entire mid-level on their own. So I don't mind not paying for their malpractice, even if I have to pay them a little bit more an hour to cover their own malpractice. Um, Specialists, absolutely 1099ers. IT 1099 or grab an IT company. Billing, Depends on what we're billing. If we're not billing any insurances, we're all cash pay, then you don't need a billing department. You need an accounting department, right? Because you're just
True.
taking cash as it comes in and services go out. If you're billing Medicare, you can have it in or out. It depends on how comfortable you are with your team. If you're billing all the private insurances, I don't see how you do a good job in house. Now, does that mean that you offload everything? Absolutely not. You'll never be able to offload everything. But you can have one or two people that can trust but verify, right? So they can keep the billing department and billing companies honest. Because there's a lot of billing companies that are doing a great job, and there are some of them that are taking some shortcuts in different ways, and some of those shortcuts can cause issues, you know. So if you're offloading a lot of the work into an emerging third world country, not rhymes with India, you know, you can have some issues there. So you want to make sure that where is your data going, right? You're still in control of your data. It is you are the covered entity. At the end of the day, you'll be the one hoisted on that pike. You want to make sure that you put their body in front of you. You need to make sure you have somebody that you can hold accountable for it. So
Absolutely.
make sure that you got that.
I got one for you. Obviously business associates, they fall under HIPAA rules and they technically need to have a compliance program in place and a training
Yes.
protocols, policies,
There's no
procedures, et cetera.
technically, they have to.
No, they have to. They have to. So going back to, 1099 physician, right? Let's just say you have a 1099 at your practice, right?
Yep.
And you have a compliance program in place, right?
Yep.
Are you obligated to provide those policies, those trainings to
No,
this
they're
1099?
they're okay. Hold on now. See this is what I'm
I,
talking about
I'm
when you start
I'm
making things
I'm
complex.
I'm throwing you a curveball because this happens more often
It's
than
not
you
a
think.
curveball. You ended up you've blurred the subcontractor employee relationship.
Right.
So now when OSHA comes to you, when workers' comp comes to you, they're gonna rake you over the coals because you provided a subcontractor employee benefits.
Yeah.
You have just failed the 1099 test. If they are a 1099, you don't give them ish.
Perfect. Perfect.
If they are a
They are responsible
1099er,
for their
they
own
need they are
compliance.
responsible for everything.
Yeah.
That's the point of being 1099.
Yeah.
That's the benefit of being 1099. Because now, as a provider, if I'm a 1099er, it means that I can go and do everything, but it's a tax deduction for me. A 1099 is basically self employment. I can work at 40 different places. I
You,
just need to make sure I have my stuff together and be organized,
you'd be
which
surprised how much
therein
that
lies the problem.
that comes up though is, hey, I have a
Absolutely.
1099. Do I put them on our training program? No.
Well, let me ask you this. That 1099er, is he on your 401k plan? He better not be. Is he on your health insurance plan? He
That'll be
better not
my
be.
that's going to be a part of my if I get that question asked to me again, I'm going to ask that.
Like, what? He's a 1099er. Tell
Yeah.
him to buy his own ish. You
Yeah.
know what I mean? Like, it's
Yep.
it's it's the cost of doing business. Now, when these 1099 providers finally start figuring this out, they're going to have to internally do that mathematics and say, is it worth the liability for the benefits? Is the juice worth the squeeze?
Absolutely.
And there may come a time pretty soon that a lot more of these 1099 providers are going to have to really come to terms with that. Especially if some of the things I've been hearing about providers being able to unionize comes through. If they can unionize, that's going to be a whole nother problem for 1099ers because they will not be able to union. They will have to
Yeah.
find a union that they can join. Similar to the way SEIU and I think a few others operate. I don't keep track too much of unions because we're in Florida. but I know California's pretty heavy unionized, and nurses have a union out there, and it's been causing Kaiser Permanente giant problems. But that's a whole nother bag of tricks. So yeah, so I mean, if we're talking about vendors that we need to make sure we have a business associate agreement that we have to supervise, I wouldn't even supervise them, honestly. I would just send out a questionnaire. Hey, just doing my, bare minimum. Well, what do we got going on? Hey, do we have policies and procedures? The second they say yes on there, you can rake them over the coals if something happens and they don't have policies and procedures. If they ask you what an SRA is, it probably means they haven't done one. It's safe to assume that, which means that they need to get one done if
One.
their services are being billed.
Mhm.
So I mean, it's all about what are we doing? What are the services that are being rendered to us? Um, if I've got a guy creating a website for me, that's my web guy is not a business associate. If I have a marketing department, now, all right, we need to be careful with Stark Law. Here's what I mean. I can have, and it is very common nowadays to not have a marketing department, but to have a marketing subcontractor. I pay this company, they do a bunch of marketing, they do a bunch of outreach. We need to be very, very careful how that contract is structured because Stark Law has gotten murkier, not clearer, especially because of the Chevron defense that has been overturned, especially with the way that OCR and DOJ is now looking at the way Stark Law works because thank you private equity being part of jumping into healthcare in the aggressive way that you have. So if I have a marketing company, I need a business associate agreement and I need to be very, very clear about what are the metrics that they are getting paid for. Do not do a per patient. That is a kickback. It will kill you. People do it still, and it was one of the cases that we went over right before
Right.
Christmas.
Yep. I was gonna say.
And it's something that has flat out been mentioned on the DOJ website that they are looking into larger practices for Stark Law violations. And larger practices tend to have the marketing companies, and the marketing companies are getting smarter. And you're seeing this. You're seeing this a lot with Medicare Advantage companies and marketing for Medicare Advantage, where, hey, all right, I'll get you X amount of lives. All right, I want to get paid for X amount of lives. That's a Stark Law violation. Do not pass go. Do not collect $200. I hope you like orange.
Yeah.
Like it's that simple. Really, really is. Okay. So we need to be very, very clear with those. I'm trying to think what else, what else, what else. Printer leasing companies, you need to get a BAA with
It's a good
them.
one.
They don't sign it. Find a new printer company. If you need one, contact Rare Eye. I've got two companies I'm more than happy to connect you guys with that I've done work with. Um, let's see.
Data
If
shredding
you have
companies that are on site and off
shredding
site,
companies,
obvious.
shredding companies, you need a BAA for. Um,
Healthcare attorneys, if
let's
you're exchanging sensitive information with,
You're
right?
always exchanging sensitive. If you need a
Well,
healthcare
yeah,
attorney, you're exchanging sensitive information.
yeah. Well, that's a given. Given.
Well, because it's either HR related or it's patient related or it's vendor related. So
Yeah.
you're screwed. Um, so you're always going to need one for attorneys. Accountants are interesting because depending on what the accountant is doing for you is whether or not you need one for them. You need to go blow your
Sure.
nose.
No, I'm good.
Okay.
I'm trying to mute myself anytime I'm hacking over here.
So yeah, so I mean, so accountants could be interesting. It depends on the services they're providing. If they're just providing regular bookkeeping, then no. But if they're doing anything forensically, if they're looking into specific accounts, now we've got a conversation, right? So it just all kind of depends on what we're doing. Let's see here. What else do we have? Transcription services, duh. Translation services, duh. The translation services, I don't normally find that they have um policies and procedures, though they should, but they don't normally also hold on to any data because they're usually just translating in the visit, and that's that. So unless they're really recording something that's a very low liability, should they? Absolutely. Is it something worth picking a fight over? Probably not. Because it's very low risk. It's still risk there, but it's low risk.
How about
Transcription services. Hmm?
telehealth platforms, right? Yeah, I mean,
So video conference. So okay, so that one's an interesting one, right? So
yeah.
if I'm Practice Fusion, I have a BAA with UpDocs that I'm using that they're white labeling for video conferencing.
Okay.
I as the client of Practice Fusion need a BAA with UpDocs because I am transmitting or they're storing or they're creating patient health information. But so they would need one with both of us, right?
Gotcha.
However, if I'm Athena, where it's all white labeled in, then not white labeled, but it's incorporated in and it's internal, the
Hmm.
video conferencing tool,
Hmm.
then no, because that video conferencing tool is part of it. Fax to email. If I'm doing something with that, then absolutely I need to have BAA with them. If I'm doing something with a fax to email or something or some kind of document management system.
Okay.
If anybody's got any questions, put them up because I'm running out of stuff and I know I'm probably missing a few.
I'm trying to
Because
think. Cloud service providers, I guess, would be one.
well, I mean, but if it's 365 or Google Office or anything like that, they're
Google
gonna make you
Cloud.
sign one in the contract.
That's true. It's true.
And if you say it's so stupid. Okay, so 365 and Office need to clarify something for me. How is it that if I say I am an accounting business, engineering business, 365 costs one price. But the second I say healthcare, it is twice as much. It's the same product. You can't convince me otherwise. Show me how it is so much more secure for the healthcare clients versus the regular clients. It's bullshit. It's a bullshit tax that they have for the healthcare industry. And no one has been able to convince me otherwise.
It's just automatically assumed higher risk, and that's what they do. It's crazy.
Yeah, and that's exactly what it is. Even though, okay, so let's go ahead and play your little game. You mean to tell me that
It's
if
not even
I'm
a
not
different look and
healthcare?
feel of
Yeah,
of
yeah.
the
Oh, wait. So
product.
let me
It's
get
the
this
same
straight. So
thing.
it's okay. So it's
Have
super
you A/B
secure.
tested this?
Now, I have actually talked to salespeople and done this whole rigmarole of okay, I'm this versus I'm healthcare, and it's
It's
all
the
and I'm
same
just
thing.
I get heated with them because I'm like, wait,
Man,
what's the difference between the product? Because somebody's getting screwed here. Either the non-healthcare client is getting charged for less for a better product, or we're getting charged more for a lesser product. Because there's no way that you're going to go through the trouble of all that programming and not just public it out. It doesn't make any sense on a
mhm.
macro scale,
Yeah.
which is what you would want. But
Point.
well, I'll wait.
I didn't,
I
I
cannot wait.
didn't, I didn't know
Hit me
that.
up, Bill Gates. Let's talk. Like
The dog eat
let's
dog
talk.
world over
Yeah,
here.
right. I'm curious. Um, you're never going to get a BAA with an insurance company. I don't care if you're one of their MSOs. It's never going to happen. So don't bother trying. They're going to say TPO, we're a covered entity, bite me. Okay, cool. That's fine. You're an insurance company. I'm not going to bother. Um,
Trying to think of some.
if you, oh, go ahead.
I'm trying to think of other scenarios. Did we talk about data backup and recovery company? I guess,
Usually that's white label under IT, but if you have a separate
yes.
company for that, it would
You're right.
be if you have a separate company for that, then yeah, you would need to be a
You're you're right about the white labeling. Mostly that's done through IT.
yeah,
But
mostly IT or even your EHR. Excuse me, because most EHRs are cloud based now.
mhm.
So all that data is backed up in a couple different sites.
Staffing
So
agencies. We didn't talk about staffing agencies can be considered a BA.
staffing agencies. Oh, you tricky, tricky. tricksters. And here's what I mean by that. There are traditional staffing agencies, temp systems, things like that, where, hey, I pay you as a staffing agency, you pay your employee. I have the BAA with the staffing agency.
Hmm.
That BAA covers all of their employees, much like a billing company. But you get some of these little interesting staffing agencies where they'll go and say, "Hey, I'm going to bring you virtual assistants." They basically operate as pimps because you have to pay them, but technically, the way that they structured their organization, each individual virtual assistant is their own separate company. So they won't sign a BAA with you as a staffing agency. You have to get it through the individual virtual assistant. But you're paying the staffing agency that then pays the virtual assistant. Make that make sense. Somehow magically they're 1099ers and employees all at the same
At the
time.
same time.
How?
Yeah, that's
And this does not happen. I've not seen this happen with organizations, staffing agencies that are bringing in virtual assistants that are stateside. I'm seeing this a lot more with staffing agencies that are finding people that are in the Philippines, in India,
hmm. Yep.
in Taiwan and Thailand. So be ask the question if you're going to get a virtual assistant, where's this person from? Is their English very good looking? Because if it's not, you are probably going to have a problem depending on if you're anywhere outside of Florida and California, and maybe South Texas, right? Like you're gonna want if you have a virtual assistant, you're gonna want somebody that can speak the language of your clients. The
Absolutely.
thicker the accent, the harder it is, and the more likely your patients are gonna get upset. So it's just a reality of the matter. But yeah, some of these staffing agencies are wild. They're doing. I don't know how they get away
Absolutely.
with it, but I'm waiting for the IRS to catch them. IRS is undefeated, you know? So,
That
let me
that might be
see.
their next play. Who knows?
Yeah, might be. I can't think of any other ones, but if anybody's got any, like I said, throw them up or put them in the comments in our on the YouTube page, and we'll take a look. But that should cover almost everybody. And like I said, a lot of these are low risk, but your billing companies, your IT companies, those are your high risk business associates that you probably need to keep a better eye on and go through a little bit more trouble vetting because they're touching your money. Anybody touches your money, anybody touches your data, which is money, you need to be very, very careful who you get into bed with. We're seeing more and more nowadays, people are getting into trouble because of business associates, because your name as the covered entity is the one that ends up on that website, on that OCR website, not the business associate. We don't see the business associate on there.
Right.
Usually it's when we expand it, it just says, oh, yeah, business associate was involved. That's it.
Yep.
Now, if you're clever, you can assume based on the type of breach that it was, what kind of vendor that it was, but you're assuming, you're guessing. You have no actual proof, and you definitely don't have any proof as to who was that vendor. So you're the covered entity. At the end of the day, the federal government is going to do everything they can to hold those that have professional licenses accountable. Because if you have a professional license, it means they have a database and they know how to get a hold of you. And it means you have something to lose. If I'm a mom and pop IT shop, I can literally just open my doors and shut them on a whim. There's nothing to hold me accountable. There's nothing for the state to hold accountable. They're going to hold you accountable. They're going to hold me accountable. They're going to hold my providers accountable.
Yep.
They're going to hold your providers accountable because we got licenses. We've got skin in the game. So the BAA allows for everybody to ante up.
Absolutely.
So I think with
Uh,
that, that's what I've got, Ray, unless you've got some questions or
No,
concerns you want to go
I
on.
think that drills it down. I mean, I think we've covered quite a few different scenarios.
Yeah, I'm trying to think of one that would be odd. But I mean,
I've gone
even
through
if
the
I
ones that
lease,
I've gotten the most out of most
I mean, even if I leased larger equipment, which is not uncommon, like an MRI machine or something like that, I mean, yeah, they would also be BAAs, just the same way as a printer leasing company would be, um, so yeah, so I mean, it's not that wild.
yeah.
Um, but yeah, so next week, then 5 days from now, right? Yeah, no, 4 days from now.
Yeah, well, this is it's going to be a quick turnaround, which makes my life better. I'm gonna have fun editing here these these next
Yeah, you
couple
got the
days.
weekend. Get to work, son.
Yeah, yeah. Actually, I'm gonna try to maybe get this edit done and up on the YouTube by the end of today if I can make
Oh,
it
okay.
happen. If I can make it happen, we'll see. YouTube just takes sometimes I don't know what if it's I haven't pinpointed it yet, but it's like some days it'll take lesser time to upload a video, and some days it'll take
I know some
two or
people
three
that say the
hours.
same
I'm
thing.
like, what in what is
There's
going
no
on
rhyme or
here?
reason. From what I
So
understand, there's no rhyme or reason. It's just kind of how it goes.
So I'm actually
So
interested to see how this one goes because maybe it's like a usage thing. There's so many people uploading a video on this particular day. Who knows, man? I can't
yeah,
figure it out. But there's been some occasions where it's only took about 40 minutes to upload a video, and then there's been some occasions where it's literally took like 2 or 3 hours, and I'm like, what the hell?
that's
So
wild.
I'm gonna see if I can chop this one up and get an upload in and see how long it takes on a
Cool.
Friday. So,
Yeah,
but
yeah.
yeah, quick turnaround. Next week, we're going to be talking about, let's see, good Lord. Oh, who gets access? Navigating
That's
compliance
right. Let's
with
play a little game.
the third party vendors.
Not well, yeah,
Well,
with
not
third party
just,
vendors, we can do
but
with different types of patient scenarios, which
yeah.
can be a pain in the ass. Yeah, so that'll be a fun one
And then,
for you and I.
after that, we'll be back on our regular scheduled programming. But that would be so that's next Tuesday. That'll be the 7th, and then the week after that, the 14th, we're going to be talking about the Aetna article that you sent me.
Yeah, that
So
one's gonna be. Oh man, I got shit to say about that. Oh, Etna.
yeah, that'll be a good one. And then after that, we're an open book from there. But I know we'll have some things
Absolutely.
come up here as always. This
Yeah, absolutely.
Yeah, so today was our what? This was our, I'm trying to think
First
here. This is our
for the
50,
year.
57th, well, first of the year, of course, but 57th uh subject that we've covered since we've been doing this.
Nice.
So,
Nice.
so
So cool.
cool. Well, hey, I appreciate everybody taking the time to tune in today, and look forward to seeing everybody next Tuesday. And Jose, as always, appreciate you being a part
Stay
of this.
warm.
Yeah. Yeah, stay warm, stay healthy. And yeah, we'll see everybody next Tuesday.
Bye.
Take care, Jose.